My name is Suzanne Groah. I'm a clinician scientist at MedStar National Rehabilitation Hospital. So I'm a physician in physical medicine and rehabilitation. And I also run the research program within MedStar based at National Rehab Hospital. Our focus is on urinary tract infection diagnostics, and also neurogenic lower urinary tract dysfunction. I do a lot of research in the urinary tract infection space, specifically in people with neurogenic lower urinary tract dysfunction. And I was drawn to this because I can see this technology particularly helping this group of people who have frequent urinary tract infections, who have neurogenic bladders, who have catheters. But not only that, I see it helping many, many people, the whole spectrum of people with potential or suspected urinary tract infection. Challenges that I face clinically are when my patients present for a suspected UTI, I really don't have much information at the point of care to decide whether or not to treat them with an antibiotic, and then if I decide to treat them with an antibiotic, determine what antibiotic to use. The technology fills a gap in the clinical space where we don't have anything. So when I go see a patient for a potential urinary tract infection, and many of my patients have suspected urinary tract infection, all I have at the point of care is to really talk to them about their symptoms. And so we've done a lot of work trying to really learn about symptoms and see and determine what symptoms are indicative of urinary tract infection, but we don't have a good test right at that point of care to help me with my decision making. So I'm really excited that the GDO analyzer can really aid in our decision making at the point of care. I see Astek Diagnostics addressing the current challenges that we have of not having a good, reliable, and validated diagnostic test at the point of care when we're seeing a patient that actually provides results in a rapid amount of time. And what do I mean by that? Within 30 to 90 minutes. And this device fills that gap, and it addresses a huge need that we have in the field at the point of care where we're actually seeing the patient, and it does it quickly. My vision for shaping Astek Diagnostics in the scientific space is to really design and actually carry out some clinical trials to not only refine the technology, but also to really determine how we're going to use the device in clinical practice and determine parameters for use of the device to aid in decision making. My priorities for building relationships are critical because when we treat people for urinary tract infection or other infections or other conditions, we are not just treating people and telling them what to do. We're a team and we work with the patient. So my priorities are working with other stakeholders as we develop this technology to get it out into different environments where people may benefit as quickly as possible. And what people might that be? That can be the clinicians and that can be the patients themselves. And also to work with the patients so they understand the new process. Patients are used to waiting for a couple days for their test results, or they're used to their physicians telling them they have to guess at an antibiotic. So this is a new process for patients. This is a new process for clinicians. And so part of getting this technology out there is really working with all these stakeholders because, again, this is a device that provides new information quickly and at the point of care. And so that's new for all the people involved.